Hey everyone, we're here today with my doctor friend. She's a board member from for my company Viseo. She's one of the doctors on our advisory board, and I am always so excited to hear from them. They are a panel. They are just they are helping people with their practices and also with our company. And I'm just really excited today. Thank you, Lana, for Dr. Galicia. I hope I'm
Good.
pronouncing your name okay. I know I'm just so excited to have you here. And I know you and I had been wanting to chat for some time. So we'll chat with everyone together. How
That's
are
right.
you?
I'm doing marvelous. Thank you. And hello from the very sunny California.
Love you guys. So, like I mentioned, we have the board. She's on our advisory board. And I love hearing so many things about their, stories, how they're helping people. But let's start out with yours. Lana, and tell us why you are here, why you said yes. What's your opinion on this industry, which I like to say it's a direct way to get it to the people, a direct way to improve the lives of people.
Yes, I'm so blessed and really blessed to fortunate to be with you today, this morning, this lovely morning. I call it a blessed morning. And again, as always, I would like to praise my Lord and Savior Jesus Christ for
Yes.
putting me in this condition to a situation where I'll be able to reach out and relay the message. And really, as you very well know about why Vaseo, why now, why. I mean, there's a lot of really good questions, but back in about a few years ago, 3 years ago, actually was diagnosed with cancer, and I went through treatments and all the other things. Unfortunately, it rendered me with some side effects from the treatment. Thank God and praise God that I am cured from the
Thank God.
cancer. Praise God for
Praise
that.
God.
Yes, indeed. However, there were complications from the treatment, and one of those were quite really affected me tremendously because it affected my memory. And I used to have a very photographic memory. I remember little details of my patients' life, even
Mm.
their vacation, the kids' names. I pretty much know them. And and that's the degree of personal relationship I have with my patients. And when I lost that skill, or I call it a gift, I started looking for ways to look apart from praying to God. And then the Lord actually maybe called that person who
Mm.
made that very cold call, uh, my
Wow.
actually my clinic number, and invited me. He happens to be
Wow.
one of the person whom I honor, Dr. Garcia, who happens to be she became my wonderful friend. She's a well-known OBGYN in this area, and called me and basically invited me to listen. I didn't even ask what it was about, but the fact that she's a physician, I admit that the trust is right there, is there right away.
Right.
And yes, and so I went there. I sat like any other person who was invited to listen to the opportunity, but more so, I was interested in the products, and came this wonderful product called Neuro. If you will ask me what's my favorite product,
Mhm.
that's Neuro. That's the very first product that actually got me into, okay, this is something that I really need to look into and try. And hence I started using it. About I would say 4 to 6 weeks into using Neuro, it is really interesting that it wasn't me who noticed it. It was my medical assistant in
Mm.
my clinic. In my clinic, I have this. When you are a patient, you had to fill out 2 pages of follow up, and for a new patient, you fill out I would say 17 pages
Mhm.
of consultation, reports,
Right. A
and
lot.
a intake questionnaire. And the 18th page or the third page for the follow-up that was actually meant for me. It's meant for me to write down my findings, and then my plan, and my care coordination. And the reason why I write is because I forget things. And that was the third that was that page was meant or were meant for my own use later on in the day. That way I could transcribe my report, so I can transcribe my report. So 6 weeks into using neural, my medical assistant actually came to me and said, Dr. Galicia, she said, in the last couple of weeks, really, I haven't been seeing you writing anything on that page, on that piece of paper. And do I still have to make copies of it? Because it's just a waste of ink and paper.
Uh-huh.
So that she
Gotcha.
was the one. And then it dawned on me, like I was able to transcribe my reports at the end of the day, and able to build those those visits without delay. And wow, that was a blessing. I've been waiting for that product for the last 3 years of my life, and the Lord answered my prayer.
That's
Hence,
great.
I'm still improving. I'm still a work in progress. There are certain spurts of memory lapses, but the Lord has been, for the most part, I would say 80 to 90%, I am restored.
Great.
So, yeah, so that's the very first thing. And then came uh, renew my family. I'm a Filipino. We love our rice every single meal. We love our bread in the morning. Both my parents are diabetic,
Mm,
and some of my relatives are diabetic. So I started using Renew on them. One of my good friends is also, we Filipinos, we also have this enzyme deficiency that actually makes us predisposed to develop gouty arthritis. So
oh,
I started using this Renew on and shared it Renew to my loved ones, and lo and behold, my mom's hemoglobin A1C, you can't believe, you won't believe it. It really went down by 50% by the third month of using it. She was 13 milligrams per deciliter, which is exceedingly high. That's a
mm-hmm.
sin when you have that kind of level. And about 3 months of using it, I saw it going down. It went down. Now she's now at 7 milligrams per deciliter. And then uh, when I saw that kind of response, then I started sharing it with my patients.
Okay.
I started sharing with my patients. I'm a pain physician.
Right.
I deal with pain patients. And as you very well know, pain patients have, apart from their pain, they suffer from sleeplessness, from insomnia, from anxiety, from depression, and all those things. Hence, we have those tools to actually, address those kind of pressing medical issues. And since 2017, August of 2017, I stopped prescribing benzodiazepine, the name of
Wow.
Xanax, Ambien, all those trazodone, all the other sleep aids. I stopped prescribing them because of sleep, because of now the CBD too on top of that. So
Right.
it's tremendous. It has changed the way I practice. It really did change the way I practice. And unfortunately, there are a lot of challenges, especially in the medical. And I have to admit, when I was in medicine, unfortunately, we only have a few semesters of biochemistry, which maybe a few weeks, I would say even a few weeks of nutrition and
Mm,
and diet. And unfortunately, that's just the reality of it. Hence, we are not the expert when it comes to managing giving the right recommendation as far as nutrition. But it has been my dream, and thank God he answered this, that he provided me with the tools to share with my patients and to my loved ones the ways to take care of this body that was actually and entrusted to us by our God. This is the temple of the Holy Spirit, I call, and we need to take care of that. Don't wait until you get sick, because sickness is hard, it's expensive, and you
exactly.
suffer. Yeah, so
It's more
thank God
expensive to
for,
be sick than take the supplements.
absolutely. And thank God for Vaseo for giving me this
Right.
opportunity to get better, to be well, and to be able to share that blessing to the rest of the people that I love and the people that I touch, and we continue to change lives. It's amazing. It's
That's
really
why
amazing.
I basically called it that, like, how can a healthcare provider, whether they're a doctor or in alternative medicine, even by means of being like a masseuse and down the line, how can they really help their clients, you know, because the patient has to take it in their own hands. Like you said, the medical profession, the way it's set up, it's, not everyone does like the extra step like that. I know you do, and some do, but how can they, like, I know one of the board, it's the Viseo other doctors, he stood up and he said, we really cannot, I don't remember who it was, at one of the conventions when he spoke, he said, with Renew, like he was talking on Renew, like, to us, to like, we have it in our hands to spread this great product, and the medical profession, their hands are tied at some times. So he like urged us to go out and, and talk about these products. So what how can like how can other doctors that are not doing alternatively, means to help their patients, how can this really speak to them, to tell them what this means to them, what this could do?
Well, the way I approach it, when I approach my colleagues, is basically, number one, they need to be equipped with the knowledge. The lack of it is kind of problematic. So we people who actually has knowledge of this discipline, call it the discipline of
Okay,
branch of
a
this is
discipline.
medicine. This is a branch of medicine you call alternative or complementary medicine. That- That's basically what you use. It is an acceptable modality or modalities
Okay.
to help our patients. If you we have drugs which are chemically modified or chemically produced. We also have physical therapy for patients who have pain. We have interventions and injections, like in my specialty, to take care of the pain. Injections, and eventually you need surgery if there's an anatomical derangement that's causing the dysfunction. But in this part of care, medical care, is what we call complementary and alternative medicine. That comes with sleep modification. Even psychology is part of that. We have a part where physiotherapeutic modalities, and then and this nutrition and dietary, and is gaining popularity. That's where the future is heading,
Hmm.
as far as the care, pain care, in my specialty. That's where we're heading. We need to emphasize the value of complementary and alternative medicine. So
Can you talk really quickly about, we're not going to get into, ladies and gentlemen, what's in these products, but you could definitely get back with me, and I can get with any one of our doctors if you have a question. But can you speak about, our products, like how they do well with partnering? And not only that, how they're formulated all together in just the right formulation. You could maybe mention a little bit about Tracy Gibbs, what a amazing person he is, and just a little bit about why our products are so amazing.
yes, friend, done a lot of research before I even got into accepting the this opportunity in Viseo, being a brand partner myself, as well as part of the scientific advisory board. I really honor Tracy Gibbs for dedicating his life on looking into healthy ways to help people. Um, we have the amazing tools. We are, I would say, superior above the rest of products out there because of the delivery system.
Right.
That's what sets us apart. Yes, it's true. What we don't put fillers. We don't put additives that are harmful in our products. That's, we are organic. To name CBD, we have the patented. We are the only one with the U.S. patent as far as the CBD liposomal CBD, and with all the other products that we have that are liposomal based as well. So that sets us apart, and that is key. It's non-compar there's no comparison to the other products out there. If you think like CBD, in fact, if you look at there was I don't know if it's a documentary, but a segment where Dr. Oz and Dr. Gupta were actually together and they were talking. It was one of the TV programs, one of I believe about a year ago, and they looked at the amount of CBD out there, and it's so variable. It's just a war zone out there when it comes to CBD products. It
Yeah.
varies like so vast that you don't know which is which, you know. But I have to tell you, when they went sampling, basically sampled a lot of the products out there, and what they found out, what those companies have claimed. I'm not gonna go over those companies, but those other companies have claimed that they have amazing bioavailability, but lo and behold, even the amount that they claim is not even there. So they're, 3% bioavailability max on most of the ones that they actually looked at. But with our liposomal advanced technology, it goes up to 90 to 95%. And that is such a critical point that we need to deliver. We need to deliver this information to our care providers, to our medical care providers. Same way with all the other products that we have, including Renew. Those are all liposomal based. Curcumin, turmeric is a huge molecule. The same way with melatonin in sleep. That's a huge molecule. There's less than 5% absorption. But when you liposomize it, you can just imagine the amount that is actually bioavailable. Bioavailable is basically, it is readily available for the cells to use. So that's what we have.
Hmm.
And the enzyme technology with all the other products as well. It's just, if people can just understand the how special these products are, I mean, why would you not share it? I mean, yes, we didn't have this Veseo um, scientific studies. You don't need that. If you have thousands of people that you actually help, and if you look at PubMed, PUBMED.org, and try to research on each and every ingredient that's in our products, just a vast literature about its therapeutic benefit. And I'm not gonna claim that is a cure, but and I have to say that, okay? But I want this our people and those people that you share this information with, that they equip them, go tell them to go to pubmed.org, and there's a vast of studies out there regarding this ingredient. And then you also add liposome, and they will know and exactly what this technology is all about. So that sets us apart. That sets us apart from all the other products out there. We have something here that's powerful, that's transformative, that is effective. As you very well know, I'm also an anesthesiologist. That's my primary
Okay.
specialty before I'm a pain doctor. A few of our drugs that we use in the OR are actually liposomal based. And those are the
Okay.
products that are very predictable, meaning that when you give it, boom, you know that it will be effective right away. And when you turn it off, when it is going to wear off. But what we have right now is, it penetrates through cell and it acts on the cell, as far as the products, effectively, as far as our products are concerned. So I really honor Tracy Gibbs. This man is such I mean, his fond of knowledge is just unbelievable. I would say he is one of is such an intelligent individual with a heart.
Hmm.
And that's what I love about Tracy. I'm so blessed that and fortunate that the Lord put him in my life, and the rest of the scientific advisory board, and all the brand partners that I work with. I am just so blessed that I have this opportunity to make a difference alongside with all these people with me in Vaseo. I'm so fortunate that we have the leadership that we have. We are just so fortunate that we have the leadership that we have. We are so intelligent, so advanced in their thinking, and they are so innovative, and they are so loving. They are so they are people persons. Basically, they just mean well for the people. And I just honor them, and the Lord bless their heart, bless you guys for doing what you do.
Right, and that's our leader. I put up his name, Dallin Larson, that you probably are mentioning as well. The leadership has given is so they're so special that they're coming back to do this just to be able to bless the world and, given Tracy the credence to go out and get the best products that there are out there. And he knew Tracy for a long time, that he was the one that he needed to be the one to have like the almost the carte blanche to do so. So I just wanted to make mention of what this company is really all about. And I know that you really mentioned so beautifully how they have a heart for everything like that. And we were just awarded as one of the top 50 companies in the healthcare in the world. So we are basically up there with just any other healthcare company. Um, how do you feel about that? I know.
Well, I would. It's again the blessing just, and when the floodgates of heaven opens up, oh my God, the blessing just pours. And this is critical that you need to mention that. I'm just so glad. It is imperative that each and every brand partner in this organization need to mention that we were awarded as one of the top 50 companies or organization in healthcare in the entire world.
Right,
Not only that, we are the only one that is in the networking industry. Okay, we are the
right,
only one in the top 50 that's actually in the networking industry. So I mean, that is powerful. That says a lot about of who we are, what we are, and what we are as a company. Again, as they mentioned, every time all the five stars have aligned in Paseo.
right,
The leadership, the products, the people that we put together, the compensation plan, and more so, the outreach that we do, that we have partnered with Hearts and Hands for Humanity, and
right,
and the difference that we've made in other parts of the world. That's also that maintains good health as well. That we provide clean water for these people in Africa, and we continue to do that. And this, I mean, that's just the generosity of this company and the brand partners. I mean, can you just imagine all these stars are really well aligned, and it's, I call it the divine intervention. The Lord put us here for a reason, and we have a mission to accomplish, and we better make sure that we comply and we
right.
do what our part in the grand scheme of things, and in His master plan. We need to do our part to share that.
And just to go over again, like I did mention it in the beginning, like direct to the customer, direct sales, whatever you want to call it, is so of this age as well that we're living in. And, we call it the business of the 21st century, whatever. But I hear things still, people don't really want to be ready for it. I wrote down, I saw someone post in a group that was asking for some help with CBD. And they were like, but don't write down any CBD if it's from a direct sales company. And I just felt that, that's like a misnomer almost, I mean, they're not really in the know. Can you give your opinion on that?
Well, again, unfortunately, with the signing of the farm bill by President Trump, at least now it's becoming it's becoming an acceptable norm as far as that product is concerned. Again, I expected this because of the fact that it has been illegal for many years.
Okay.
So again, we cannot blame them for the lack of knowledge, but we have to update them that this is acceptable. And the bottom line here is it's THC free.
Right.
That's the one thing that you really have
Exactly.
to mention is you have to emphasize that this is THC free. We have a psychogenic type of ingredient that is so powerful, that is liposomal based, that will make a big difference. In fact, there's such a vast knowledge about this. You can go to pubmed.org again about CBD. They've made a lot. There's a lot of literatures in the early 1980s and early late 1970s, and you'll see that. Unfortunately, during that time, it is not accepted because it falls under the illicit drugs in the past.
Okay.
So we have to educate people. We have to educate people that we have something here that is so powerful, that is not there's zero THC, and we have a third party lab that actually looked into it, and indeed we are zero THC. We have it is organic, from seed to plant to packaging, that are all made in the USA. So and it goes through really a tremendous, really a very, very strict guidelines, and quality control, things like that. And we need to tell these people, because like I said, when you go out there, it's it's just amazing, the the vast products out there, and they claim what they claim. And I tell you, in my practice, I actually had three patients who came to me and said, "Hey, Dr. Galicia, I got this CBD and it didn't work." And then I asked, "Okay,
Right.
where did you get it from?" "Okay, we got it from this and this and this." And they told me it's THC free. Okay, I told them, "Okay, why don't you bring me that product here? I want to check it and I want to test you." And lo and behold, you look at it, it's THC free. And when I tested this person, these three people, they all tested positive for THC.
Wow.
So again, you have to be very, very careful. Unfortunately, some of the products also, they put additives, they put fillers, they put all the other additives, thinking that it's going to prolong its half life. And unfortunately, it can actually cause harm to the bodies. So we have to be very careful. But with the product that we have, I'm very, very assured that this is organic, and this is zero THC, and we're the only one with the U.S. patent as far as liposomal CBD is concerned. And it has helped and changed my practice. It has helped a lot of my patients. And if you would look, I would like to look at the benefits that you can get from utilizing it. Go to pubmed.org. There's a lot in the 1970s and 1980s and recently. And I mean, this is something we need to equip ourselves with, this information, and go to pubmed.org.
Right.
As
And
far
then,
as combining,
yes,
sorry.
that's the other thing that I'm mentioning to you, to remember to mention how they
Mhm.
partner, and also like the CBD is also with the liposomal or transdermal delivery.
Mm-hmm. You're absolutely right. It's a liposomal technology, and we have the transdermal form, which is the topical cream that we have, and we also have the oil that you put under your tongue. I always tell my patients, put it under your tongue, wait for a minute, and then swallow the rest thereafter. And it is tremendous what I've seen in my practice, and my brand partners' lives as well, including my loved ones. As far as synergism, or when you put those
Synergist.
products together, so when you do there's synergistic effect.
Right.
And not only that, apart from synergistic effect, the benefit is amplified as well. So um I use in my practice, and this is my practice, I'm just talking from my personal view,
Okay.
that with patients who have insomnia and who have problem with pain, I use the combination of Core Complete, CBD, and Renew. And it's just tremendous, because a lot of patients with pain, chronic pain issues, they also have deficiencies in their vitamins, particularly vitamin D, and so the other magnesium, manganese, and all these other ingredients that we have in Core. And by the way, Core,
Yeah.
our delivery
Core.
system, again, with Core, we have the best multivitamins. It has everything there. You don't have to ask for anything more. It has everything there as far as supplementation is concerned.
And that
So
helps you with
and
your hair growth too after your
yes, ma'am.
chemo, and
Correct.
it's just our baseline product, so it can help anyone.
Yeah, the selenium in those products actually help with the changes that happens. I call it the tropic changes that happens with chemotherapy, or even with chronic pain. Um, uh, or chronic medical conditions or diseases, where there is the nails are affected, the skins are affected, as well as your hair are affected. The Core Complete has the selenium in it, and all the other multivitamins, probiotics, and all the super fruits that will help tremendously in maintaining the wellness of your
Whoops.
patients or your loved ones.
So that product would really definitely go along for anyone that's coming out of surgery, any kind of like hip replacement or any kind of, I have someone who just fell and has broken ribs and they're in their, recovery, they're in the hospital in pain. What products would be good for the vast majority of, people suffering from repair or surgery and coming out of, any kind of frozen shoulder, anything like that.
Well, again, I'm not saying, I'm going to share with you the way I practice, my personal experience, as well as in my private practice. Though I am not saying, I'm not
Right.
recommending
We
you to,
cannot say it
yeah,
as a cure.
yeah, that this is a cure. This
I'm
is not.
sorry
This
if
is
I
not.
didn't say it
This is,
correctly.
I call it a symptom management, and
Exactly. What
what
is your,
patients are. Mhm. Yeah,
what is your combination of products for that?
yeah, what symptom management, particularly post operatively, I mean, I have this practice where I pick up the phone and coordinate my patient's care with the other doctor who did the surgery.
Nice.
I just want to make sure that I'm not doing anything that will compromise the healing of the patient or will contraindicate whatever they're doing.
Right.
So I always do that. I coordinate my patient's care with the other provider who are
Wonderful.
involved in the care. So, but nonetheless, if grant so, like Renew has an anti-inflammatory there, which is curcumin or turmeric, and there are cases where it's very good, a potent anti-inflammatory that is good for pain control as well. I mix it with CBD. Okay. I
Okay.
always mix it with CBD. As far as healing is concerned, I add Eternal on top of that. With the collagen and the glutathione, you need those precursors to help a cellular growth and cell healing. It promotes cell healing. Those ingredients are actually helpful when it comes to that. But however, there are cases where, like spine surgeries, after a lumbar or cervical or spine surgeries where it involves fusion. There are
Mm-hmm.
some cases when doctors or surgeons don't want any type of anti-inflammatory immediately after spine fusions. And the
Okay.
reason being is you need some inflammation for the fusion to become to maintain its stability and integrity.
Okay.
Okay, if you do too much anti-inflammatory, you might end up having a failure of fusion. So I always coordinate with the care with
Right.
the surgeon. Say, okay, I'm putting this patient on this and this and this, and with Renew, you have that anti-inflammatory, and if they say, okay, go ahead, that's fine with me, and it's okay, I put it them on. But if
Right.
they say that this patient has a compromised bone fusion, then I try to avoid it.
Right.
Okay.
So we
But
would
if you
have
have,
to send
yeah,
them like the tear sheets for the doctor to look at. Always
yeah,
recommend that.
right, especially with Renew. And in terms of CBD, if you look at pubmed.org again, as far as the effect of CBD, it actually growth. So
Mm,
CBD, I put that in the mix. CBD, Eternal, Core Complete, and if they require more anti-inflammatory effect and pain reduction, I coordinate with the doctor if it's okay for me to give Renew. But those are the main products that I used. If they have problem with sleep, I don't write benzos. I give them CBD and sleep if need, if there's a need. And more often than not, there is always a need. um
right.
and then also when they have so much anxiety, all this sleep deprivation, anxiety, all those things are pain amplifiers. Unfortunately, it also causes immunosuppression. So you need to address those things too. Okay,
Okay.
so I mean, we are targeting every aspect of care when we use these products, not just physically. There's also mental or mood effect on it, which is very beneficial. So I mean, there's so much to share,
You're a
my
wonderful
friend.
doctor. I
Yeah,
just wanted to, in closing, mention again how it's so amazing to have doctors that are really, out there for the main purpose of healing and helping. And yeah, so in closing, if there's anything you want to say, just about your experience here in Viseo, or going forward, where we'll be, and how we would love to take people with us if they're interested. And thank you again.
Yeah. Well, thank you so much, friend, for inviting me, and it's just a blessing. I appreciate your you coming and basically texting me, because I need that. I think we need to, we are provided with the skills, we're provided with the company this opportunity, and it's up to us as brand partners. I suggest, and I really strongly recommend to reach out. Just don't be intimidated by your physicians that they know a lot about medicine. Yes, there's truth to that, but the bottom line here are there are things that we don't know, and we too need help as well. With our in the medical field, I tell you, we are the most sleep deprived community, and um, and we need
Terrible.
help as well. We have some health issues as well, because we don't have time to take care of ourselves, and we need to be reminded. So please don't be intimidated. Reach out to your physicians, reach out to your physical therapist, reach out to your pharmacist, reach out to your loved ones that are in the medical field. They need to hear about what we have here. They need to hear about the ingredients, and help them understand. It maybe it's a no now, but don't, it will be a yes later. And just follow up. I mean, I'm still a work in progress when it comes to the business development, but I tell you, when it comes to the clinical part of this, as part of the scientific advisory board, and as part as being a part of a business as a brand partner, I meant I need to really work on this. We have such a blessing here. We have such a powerful company with powerful products that's transformative, that will make the lives of many really become optimal, uh, physically, emotionally, financially. And in Vaseo, I've really thrived in the company of these wonderful people, the leadership, the scientific advisory board, and the brand partners. And I tell you, I think my spiritual life have also been nurtured by this company. So that's all I can say. Continue to share, open your speak,
Right.
reach out, and spread the blessings, because the human beings need this. We need it. Thank you
Right.
so much.
Thank you so
Thank
much, and have a wonderful day, everyone. And message us. And if you're in my network, like I said, reach out to me. I can get information or questions answered, and Dr. Lana as well for your network. So have a wonderful day, everyone. God bless.
God bless you. Bye bye.
Bye.